Our goal is to get people in for colonoscopy, but there are reasons why people don't want to have that done, and sometimes there's some access issues. So fortunately, there are other alternatives available, and there are at-home tests that you can do in the privacy of your own home. The most commonly performed one is called the FIT test, and basically the FIT test is looking for blood in your stool. And so that means, yes, you actually have to collect a stool sample and you have to test it. But that's the reason why God invented plastic gloves. And there is a way to do that, in a hygienic manner. And it's a pretty simple test to do. You collect some of a stool sample, put it on a card, and then send it into your primary care doctor for testing, looking for blood. Because early polyps and early cancers can shed blood into the stool, and then it can be detected via one of these home tests. The other test that is gaining more and more popularity is the Cologuard test, and you may see advertisements for that on TV. And that's basically an at-home test that is checking for both blood and DNA in the stool that's being shed from colon cancers that line the internal lining of the colon. And so, again, it's a little bit of an awkward test. There are videos that explain exactly how to collect your stool, and there's instructions that come from the company, but basically you have to collect an entire stool sample by putting a collection container on the toilet seat. And then that is packaged and sent into the company where they do their full analysis looking for blood or shed cancer cells in the stool as a very good way of identifying colon cancer. Not the best option out there for identifying precancerous polyps, but like we tell everybody, any screening test is better than no screening test.